Guyana's health minister, Dr. Frank Anthony, is condemning religious and other leaders for creating COVID-19 vaccine hesitancy and spreading misinformation. The health minister on Monday, during his daily COVID update, urged Guyanese, especially those in hinterland communities, to get vaccinated against the virus, despite the misinformation they have been receiving. Now, he said those leaders who are peddling this type of information are not doing their communities a good service, and they are putting them at risk. Dr. Anthony said as a result, the government is planning to place at least 2 health workers at health centers in all communities.
We have seen that it's not in the whole region. There are pockets in the region. So in places like Region 8 and so forth, there are specific communities, and that is because some of the leaders in the community, it might be a mixture of the Tushao, or sometimes in other cases you might have religious leaders who are peddling this type of misinformation. So they are not doing their community a good service. They're actually putting their community at risk. And we will really want to encourage them to desist from doing this. Most of them, I would say the majority of them, they are not even competent to speak on these matters. They have no health background. They don't even understand how a vaccine works. But they spread misinformation. And because they have an audience in these villages, people tend to believe them.
Now, the health minister said as a result of the misinformation being peddled by religious leaders, vaccines have gone to waste. He explained that once the vaccines are removed from cold storage, they must be utilized.
So once we bring it out from the -80, we have to put it in -20, then we move it down, and we're able to administer it at room temperature. But once we start doing that, there's no going back. You can't refreeze it. And that's why when we take it out into the community, if there's a community of 100 people, we are anticipating, let's say, 50 vaccinations, then when you go there, and if the people are not going to take the vaccines for whatever reason, then we either have to go to another place and give it, or if not, a lot of those vaccines would have to be discarded.